Hi, I'm David Sycamore. I'm one of the doctors here at Parkway ENT&Allergy.
Hi, I'm Sri Krishna Donakudi, also known as Dr. D, and I'm here at Parkway ENT&Allergy.
I do. I think we all do. I'm a singer.
Oh.
I'm a singer, and I grew up singing, and I did some musical theater in high school and a little bit in college, and that kind of primed me for ENT. When I was in med school, the ENTs came around and they were giving a presentation. The one that was giving their presentation to the med students was actually a laryngologist, and I got really excited because I could learn something about singing, and I'm going to be a laryngologist. Well, it didn't quite turn out that way, although I still do a lot with the vocal cords. I don't do as much as the laryngologists do, but it was what led me to ENT, and it's one of my hidden talents.
That's awesome.
Yeah.
How about you?
Yeah, I tried the whole musical route. I tried to get into playing guitar. I like listening to that type of music, just never worked out. So the other interest that I have is a lot of techie kind of stuff, whether it's programming on the computer or working with hardware and doing little gadgets and maybe modifying them and making them work for you and things like that. Just a lot of electronics and nerdy kind of stuff.
That's awesome.
Nerdy is These days, it's popular to be a nerd.
Yeah. Mm-hmm. I wish it was that way always. Well, what I liked about ENT the most, it was kind of a little bit of all the specialties in one. So if you're like a medicine doctor, you're seeing a lot of patients in the clinic, in the office setting, you're giving some medications. So there's a lot of that. We treat a lot of ear infections and sinus infections with just medicines alone. But then there's the other side of medicine, which is more procedural or surgery related. So as ENTs, we get to do both. And not just that, I found that the surgeries you can do as an ENT are so different from each other. So delicate ear surgery is so different from, say, fixing a broken jaw. I mean, they're two totally different things. Sinus surgery is kind of like doing laparoscopic surgeries with cameras. So you get to do a little bit of everything, which is really nice.
It's true. Well, I kind of already answered this on the last one, but in addition to my musical interests, I like kids, and ENT provided a way for me to get into taking care of kids. I dabbled with the idea of being a pediatrician, but I really like surgery, and ENT allows me to do a little bit of both. So it was the pediatrics that kind of, other than music, that directed me into ENT.
Well, I don't know how recent it is, but it's probably been out for about 10, 15 years, but I think balloon sinuplasty is kind of an exciting thing that is fairly well established now, but I was very excited about it when I first learned about it and continue to use the same basic technique. I think they expanded it from what they learned with doing heart procedures and how they can go in and minimally invasively fix a problem without too much downtime and recovery time. And I think it was an amazing realization, whoever came up with it. And it excites me to see where the direction that will continue to evolve as we go forward.
Yeah, it's pretty neat how the balloon sinuplasty has such a, just a day or two recovery time, and it really can help a lot.
Yeah.
In a similar way, I am pretty excited about the Vivair procedure that's been developed recently. This is a procedure that helps with the collapse of the sidewall of the nose. Most of us have experienced this kind of when we're sick and you breathe in, you can feel your nose go, you can't breathe. And there are some people that feel that way all the time. Every time they take a breath, their nose collapses, and it's pretty frustrating for them. And there have been various treatment options for it, some that work better, some that work worse. One of the ones that was best was a big surgery where you had to install some grafts of cartilage inside the nose, and it worked, but it was a pretty long recovery for that, and it sometimes would change the way that your nose looked. The Vivair procedure is a minimally invasive procedure that we do just in the clinic under local anesthesia, and it just it helps the soft tissues here to be strengthened so they resist that collapse, and it really helps. It's been beneficial to many of the patients, basically everybody that I've done it on has felt like it's helped.
It's a very versatile instrument that we use for the Vivair, because not only do you address the nasal valve that Dr. Sycamore mentioned, but we also can use it to reduce little bumps on the septum, maybe even do a little bit of a kind of a minor turbinating procedure to further add to the improvement in symptoms that you see.
It's pretty versatile. It's nice that we have these new tools that there's some people that have done the septoplasty and they've done the turbinate reduction and it's just still not working, and this can sometimes really help a lot.
Well, when we have a good outcome after seeing a patient and treating them and they're happy and they feel better and they say thank you, that's the most rewarding part for sure. That's what I like.
That feels really good. I love it when people come back and they're just happy that things went well and things are better for them, and it just feels good.
Yeah, that's the most rewarding part about being a physician, I strongly think.
I have one more question. So, you grew up in Louisiana. What did you like best about Louisiana?
Well, Louisiana, it's number one, a pretty friendly state. I think most states in the South tend to be pretty friendly.
Agreed.
And I think the special part of Louisiana is the food, particularly southern Louisiana, but you can find it anywhere in Louisiana. But it's especially coming from India and my parents being used to very spicy food. They enjoyed living in Louisiana and eating some hot, spicy Cajun food and Creole food.
So how long did you live in Louisiana?
So from the age of 2 to the age of 18, so 16 years.
16 years. And you're a twin, right?
Yes, I'm an identical twin. Yes.
What is it like to be an identical twin?
It's good. It's actually having a best friend around all the time. So, until we kind of split apart in med school, after med school, we essentially always had someone we can count on, someone who always had your back. All mostly the same interests. I know not all twins end up developing their interests identically, but we did, and we always had someone to spend time with. So it was good.
Awesome.
How fun. And what profession did he go into?
He's a physician as well. He's a radiologist.
Nice.
Kind of overlap a little bit.
CT scans.
And Dr. Sycamore, you're from California.
I am.
And you got to Texas as fast as you could.
Yes. Well, I have to admit, I do miss the weather in California, but I sure like Texas a lot. I've lived here longer than I did in California, I think now.
Were you in California your whole childhood, or?
I lived there until I went for college, so about 18 years, and altogether here I've been, I think, more like 20.
Yeah.
So I've been in Texas longer than in California.
And how long have you been in Texas?
I've lived in Texas about 11 years now. For training, with medical training, with my wife and I both being doctors, we had to bounce around a little bit. But finally, once we were both done with all of our training, we said, okay, let's settle a little bit back closer to Louisiana. Maybe not Louisiana itself. There's definitely more opportunities in Texas, so I think Texas was a good spot to end up.
So now you're both totally considered Texans.
Yes,
100%.
absolutely.